KTN's Chebet Berir with that story.
Round-the-clock cremations show their struggle against COVID-19. Crematoriums in the country are overwhelmed with bodies of those who succumbed to the virus burning along the streets. The country has recorded 352,991 new cases over the last 24 hours as the total number of infections crosses 17 million. At least 1,300 deaths are reported daily, which has pushed the total death toll to over 195,000. The spike is being blamed on weeks-long Hindu festivals, political rallies, and a new, more infectious double mutant variant. As the immunization week is marked worldwide, India is attempting to ramp up vaccinations as its main domestic vaccine maker is struggling to meet demand in the country and globally. To control the pandemic, the federal government of India decided to expand vaccine coverage, announcing today that vaccinations will be made available for all its citizens aged 18 from May 1st. Kenya and a host of other low and middle-income countries who depend on the vaccine imports from India face a potential crisis.
Our challenge continues to be the global supplies of the vaccines that we want to use. We also have a challenge because you all know of the Indian situation. The Serum Institute of India is a main producer of the AstraZeneca vaccines, which we have been using in Kenya, which we are continuing to use in Kenya. And therefore, the challenge is huge because obviously everybody knows what India is currently going through, unfortunately, and that has impacted on the ability of the countries under the COVAX regime to be able to continue vaccinating their people.
Serum Institute of India, which produces Novavax and Oxford AstraZeneca vaccines, warned in March of raw materials shortage after the United States export bans on specific items needed to manufacture the vaccines. However, the U.S. President Joe Biden said on Sunday that the ban had partially been lifted. This also comes after richer members of the World Trade Organization blocked a push by over 80 developing countries in March to waive patent rights in an effort to boost production of COVID-19 vaccines for poor nations. More than 826,000 Kenyans have received their first vaccine dose, but uncertainty looms over when the second dose will be administered due to the ongoing health crisis in India. The country, however, continues to flatten its third wave curve, the current positivity rate being 10%. Chebet Berir, KTN News.
All right, thank you so much, Chebet Berir, for that story that related to a discussion with a Kenyan student in India. I'm currently talking to Joshua Boitt, who's joining us live from India. And Mr. Boitt, definitely not a good situation in the country. Second wave of COVID-19 in India, and we're talking about 17.6 million cases with at least 2,771 infections, actually deaths in the past 24 hours, something that the World Health Organization has actually termed as beyond heartbreaking. Mr. Boitt?
Yes, please.
We are talking about the situation in India. You are in India currently, and we're talking about 17.6 million infections, positive cases of COVID-19 that have been reported, 198 deaths so far recorded. Within the last 24 hours, 2,771 deaths have been recorded by the government of India, something the World Health Organization has termed as beyond heartbreaking.
Yes, actually it is heartbreaking because the situation now is there. People are running up and down to find oxygen concentrators. Others are trying to get oxygen cylinders. Others are trying to get beds in hospital, but they cannot get. So the most affected cities are Mumbai and New Delhi, actually. But where we are, I'm in Maharashtra state, the second most popular state, and it's also affected, which is having 4 million cases since the pandemic started last year. The situation is there, but still, Indian government, the medical staff in India, Indian Army, Indian Navy, they are trying to help in the situation.
All right, so are we expecting the situation to get worse than what we are seeing right now? Because even the medical team, the medics in India, feel overwhelmed. Some of them have even contracted the virus from, during the time that they've been attending to patients who've had COVID-19 infections.
Yes, we are expecting actually that there'll be, this one is the second wave. We are expecting that there'll be third wave because the situation now is that there was that time that the pandemic had ceased, like November last year, and people relaxed. Actually, the problem is that the people, they relax because there is mixed communication. What I can say in journalism is about vertical communication, the top-down and the top-up initiation about COVID-19. Because people are relaxed, and when politicians are communicating, when people are communicating, when the media is communicating, the doctors are communicating. So there is mixed messaging, and people relax. Some people are not wearing masks. There are so many events which were there. Other people had gone out, and they are infecting others.
All right, and Mr. Boitt, the case numbers and deaths in India, they actually they're continuing to rise because it's being fueled by the new variant. But what is the government of India doing as a way of trying to stop the spread of the COVID-19? Because here in the country, President Uhuru Kenyatta ordered a lockdown of 5 counties that have recorded high cases, have been termed as the most infectious counties. But in India, what is actually happening? What has the government done? Because you're looking at the Hindu festivals and political rallies being the 2 major causes for the high cases of infections of the coronavirus.
Actually, there is a strategic lockdown which is there in different cities because this one is a federal government. There's the union government and there's the state government. So the state government, the most affected states like the state of Maharashtra and the union capital of India, which is Delhi, they have weekend lockdowns which have been imposed. There is an imposition of lockdowns also in Maharashtra state, like weekend. From Friday to Monday, there is lockdown. But weekdays, we are going out from 7 o'clock until 10 a.m. That is when we go out. And then the government is ensuring that there is no travel across the states. From different states, you cannot travel to other places. And today at 4 p.m., the government of India, they are, according to the news that is coming in right now, that they'll be opening a website. There's a website called CoWIN, C-O-W-I-N, CoWIN website, and there is Arogya Setu application. The registrations of all Indians, those who are above 18 years old, it will be open at 4 p.m., I mean. And then by May 1st, they'll be doing vaccination so that they can try to reduce the cases.
All right. Joshua Boitt, a student in India, thank you for giving us detailed information of how the situation is in India. But as we speak, so far we know that India has recorded 17.6 million infections of COVID-19 with about 198 deaths that have been recorded there, with health workers raising concern on how the government is handling the situation. So we wait and see what will happen even as the world shows support towards India, and of course the